Our goal was to have him apply for a green card.
Alicia Ramirez has a husband from Mexico.
I want our family to be together.
Mr. and Mrs. O, not their real names, are green card holders trying to bring their adult son here from China. These immigrant stories are seemingly worlds apart, but they share a common emotion right now. They're very afraid.
Our biggest fear is actually having him be deported.
We're worried about whether we can continue to live here in America.
The source of that fear is a proposed rule change from the Trump administration.
It's time to begin moving toward a merit-based immigration system.
The Department of Homeland Security wants to update a century-old policy called public charge, which says immigrants must show they can support themselves financially before they're allowed into the U.S. In the past, immigrants who receive cash welfare payments have had that weigh against them. But the new proposal says use of almost any public benefit, from food stamps to housing assistance to medical care, could count against families too.
Now you have a president who is standing up for America.
Alicia is a U.S. citizen and mom of a 5-year-old, with a husband here legally as a so-called dreamer. She says, out of fear that his sensitive legal status may be jeopardized, they don't use public assistance.
We still struggle.
But to be all but blocked from those benefits in the future, especially with a husband who's building up his own auto refinishing business, fills her with frustration and anger.
It almost feels like we're doing things the right way, the way that they tell you you're supposed to, and we're still getting punished for it.
With this couple, Mrs. O has a part-time job as a home care worker, and she's considered pulling back from using benefits too.
Because of our older age, maybe the U.S. government will see us as an increased burden because we're now living in low-income, subsidized senior housing using Medicare.
Rest your arm here.
That fear of using services, especially health care, is a problem for all of us, says Dr. Rayburn Lewis.
The impact I see in this community is saddening.
Dr. Lewis is Chief Medical Officer of International Community Health Services, a 9-clinic system that cares for 30,000 low-income, underinsured patients across King County.
Did you take your medication today?
Experts say the public charge proposal, if it passes, would not apply to benefits used before the rule is put in place, a process which would take several months.
You try it? Do you eat it?
But ICHS saw a 10% drop in diabetes care visits soon after the public charge story hit the media. And there's a concern child immunizations may start falling off too. Lewis says when patients skip preventive care visits, they're more likely to spread diseases and more likely to affect the public's pocketbook with a trip to the emergency room for care.
The effect of public charge is to potentially drive those costs up, because patients will engage us in the most expensive part of their illness, that is, the acute care phase.
At the Cherry Street Food Bank on Seattle's First Hill, they're bracing for impact too.
We don't want anybody to ever feel scared or intimidated about asking for food.
Christina Wong is Director of Public Policy and Advocacy for Northwest Harvest, which serves more than 5,000 people here at the Cherry Street Food Bank each week.
Thank you, thank you.
Northwest Harvest does not take public funds for its work, which means it doesn't have to record identifying information about its clients. But that client base might swell if more people shy away from using government services like food stamps.
We have created an intentionally low barrier to services.
Above all, she's concerned that immigrants in poverty will be forced to decide between having something to eat or having somewhere to live.
Many immigrant families have felt that they have little choice between, do I use the services for which I'm legally authorized to use and that I need in order to keep my family healthy, or do I forego that because I'm worried that maybe my family won't be able to stay together?
It's a sentiment literally echoing around the world by these immigrants from China and the wife of an immigrant from Mexico.
If you were able to talk to President Trump right now, what would you say?
We're already here legally, but we're afraid if we leave the U.S., we won't be able to come back in because we're using government benefits.
It's not just my family that's hurting, it's the entire community that's hurting with us.